Hi, good morning. I'm Dr. Patel. I am a breast surgical oncologist. I see patients at all aspects of their diagnoses. I see benign and malignant disease. I am here for all of your breast needs, essentially. So I knew I wanted to do surgery from very early on, but I did gravitate towards cancer patients because of the long-standing relationships you can build with each other. I get to see patients when they're scared and unhealthy, and I get them through to a point where they don't even remember it happened. It's very nice to be a reassuring partner in that kind of diagnosis and treatment plan. Cancer care and diagnoses are scary, but it can all make sense. Every part of the care, I think, can be reasonably explained. It shouldn't feel like you shouldn't understand things. And I'm big for patient advocacy. I always tell people, ask questions until you're done. Ask questions even if you think that, they're not relevant or you feel like you might look silly asking them. I really do think you can understand all of it. Our goal for you is always, we want to take care of it today. We want to take care of it for your future. We want to keep it gone for a long time. So that is our approach. And I think once you understand that, each of our roles in your care start to make sense. Really good body awareness is encouraged. You know your body better than anyone, so if something changes, please come in and let us tell you this is nothing to worry about. Don't put it off. The earlier the better. Certainly start your screening mammogram if you're at average risk. Be your own advocate. At the age of 25, all women should get a risk assessment, and that could be with your general practitioner or your OB or really anyone. It's worth knowing earlier whether there's something you could do to stay healthy. We love healthy people. As a general rule, average risk women should start screening mammogram at the age of 40. If you have a significant family history, I think it requires a bigger conversation to see if you fall into a different category, because we do have recommendations to be made for people who are high risk. But again, it's something that requires just a little bit of finessing in terms of figuring out the plan that's right for you. We know that our population comes from a great distance to see us sometimes, and so in light of that, we do have a multidisciplinary clinic that can be done. It's a day where you would see all of your providers in the same day. It's valuable to the patient, it's valuable for us, your plan is immediately crafted, but it's something that does take a little bit of planning on our part, so please let us know. I think it's really valuable actually to come in with a person. Come in with someone who is also listening, but that's what I really want patients to do during the visit. I just want them to listen. Like I said before, it's all it makes sense. There's a logic to what we're recommending, and so even if you don't remember every single little detail, everything is going to be echoed from provider to provider, and so they should not hear any brand new information as they move along. And we fully understand they have to make really important decisions on the basis of brand new information, but beyond the stress of the diagnosis, just let us do it. This is what we do, so I just recommend listening. That's it. Don't study. That's not what this is. Just come in and let us take care of you. So in this clinic, we do have a fairly small team, but it does provide a lot of consistency for the patient. So you will either be getting myself or my nurse, and it's really just the two of us that do this. In addition to that, every patient is assigned an oncology nurse navigator. They're really your guide throughout this whole process. I joke with patients, they don't have to remember anyone else, but they have to remember their nurse navigator. It's their one point of contact through this whole system, and I think that's very valuable. Patients have a new diagnosis, but they are walking into a very well-functioning system. So one less thing to worry about.